So today we're going to work on some hip internal rotation. Really important to have good rotation to have overall hip function. Your hip is a ball and socket joint, and if it doesn't rotate, then you really don't have any of the other motions either. It doesn't function the way it should. And if it's not rotating, you're also probably stealing motion from your back, your knees, your feet, depending on the activity you're doing. So if you find yourself with, low back pain, knee pain, foot pain, your hips may actually be to blame. So to get into internal rotation, we're going to do the hip sleeper stretch. You may have heard of that one for the shoulder where you're coming this way. Lots of people, you want to be in this position, kind of a bear sit position, but lots of people don't actually have the mobility for that. So grab yourself trusty dictionary, or maybe you've got some old encyclopedias that you don't use anymore because Wikipedia, and yoga blocks also work. But just get yourself elevated so that you aren't hunched over, because this spine, not okay. We want the spine to be pretty neutral. So you're going to come into, this is internal rotation. It looks like your foot's going out, but that femur in. So you come in as far as you can, bring the hand to the outside of the leg. You want to hang out here for a good 2 minutes. 2 minutes gives you a nice therapeutic response to really feel that stretch on the rotators. And then after your 2 minutes is up, you start to bring pressure into your hand. So you're bringing that knee into your hand and you're resisting yourself right at the end range of internal rotation. And you start slow and then you build it up, pushing, pushing, pushing your knee into your hand into your knee, till you get up to your safest maximal effort. And you hold that for a solid 10 seconds, then reverse the motion, pulling the knee further in. So you're trying to rotate that leg even further in. Again, maximal effort, full 10 seconds. Should feel a lot of hip stuff going. You might feel some of your adductors, like that internal thigh working. Then bring your hand back, relax your pressure, breathe in, breathe out, repeat. Do at least 3, but 5. And if you're doing them at maximal, you're not going to do more than 5.